Hi, this is Dr. Bradshaw, and this is a video that's going to walk you through how to do your Genova Organix lab test. So if you're given a lab test that does not say Genova Organix test, you've been given the wrong set of directions. Go ahead and make an email portal message over to our staff to make sure you get the correct directions on how to do this. So given that, you should have a bag that was handed to you by our staff. And in that bag, let's go through the contents. We've got a box, we've got a bag of cups. Okay, if you were not given a bag of cups, then make sure that you contact us because we need to give these to you. These are important. All right, so we're going to set this bag aside. We're going to set the cups aside. We're going to talk about the contents of the box. All right, and again, look at the side of the box. It should say Organix. Good. So if that's correct, then you're going to, on top, pull out this, what's called the requisition form. Some of this has already been filled out for you. It says right here, highlighted in orange, fill out. Anything that has that orange highlight, and this is double-sided, will need to be filled out by you. Okay? So there's a date of collection, which is when you pee. The actual date, that goes month, date, year. You're going to fill that out. You're going to flip it over. There's a section at the top, your basic demographics, name, date of birth, address, etc. And then at the bottom, just your signature. You print your name and your signature there at the bottom. Okay, and the date. Very easy. That's very important. That will label the box for the lab. And then you will also put some information on the vial. And I'll explain that in a second. So let's open up this box. This is a pee test. So you're going to be gathering urine. And you're going to be sending it back to the lab. Okay, there's going to be a set of instructions. There's going to be a biohazard bag. In that biohazard bag, there's going to be an ice pack, a wipe, there's going to be a vial, which you will put the pee into. There's going to be a pipette. All right, we're going to talk about that in just a second. The very first thing you're going to do when you get home, you've got this, you're going to take that ice pack out and you're going to put it in your freezer. This will go in the bag and keep your specimen cold while it's being shipped to Atlanta. Okay, so that's very important. So we're just going to set that aside. You've already put it in the freezer. That's step one. The other contents of the box are the actual bag itself that will be shipped in. There's some instructions on how to send that. We'll go over that in a second. I'm going to put that aside along with the FedEx bag. It's going to be shipped in and the label. We'll leave that for the end. Okay? Let's talk about the actual test itself. So you've got the ice pack frozen. Make sure that if you're taking medications, you can continue taking those. But if you're taking any sort of nutritional supplements, you need to stop 24 hours before you take your collection. All right? So if it's anything that's non-medication wise and it's a supplement, you need to stop 24 hours. That helps Dr. Hillary get a good reading and us actually getting a good test reading for the lab results that we're getting back. So make sure you do that. That's important. Prior to the test, before collecting your urine, you want to make sure you decrease your water intake just a little bit so that way you're not diluting the urine. We want to make sure we get plenty of solid urine and not just water that's being tested. So the rule is 24 hours before you take your sample, you want to make sure you drink only 24 ounces of water. That's 8 ounces of water is like a glass, like 3 glasses of water. Maximum, that's it. You can drink less, but not more. No more than 24 ounces of water, okay? And that'll make sure we get a nice good sample, a good reading for the lab test. So the day of, and by the way, I should mention, if you're a female, do not do this test while you're menstruating. So if it's, you're anywhere within the menstrual cycle and you have, bleeding going on, this will screw up the test. You cannot do it. So just wait till you're done. Then you can go ahead and get a good urine sample. All right. So what we're going to do, this vial has a cap on it and a reagent in it. That reagent is there for a reason. Do not open this up and say, oh, it's dirty in there. I need to get that out. No. That needs to be in there, okay? So don't worry about that. This pipette you're going to use to transfer the urine from the cup into the vial. All right, so here's how this is going to work. You're going to collect this urine at night or first thing in the morning. All right, so if you think, oh, I'll just do this, in the middle of the day, get it over with. No. There's an actual rhyme and reason for all of this. We want to make sure we collect the urine after you've been sleeping for a while or the first thing in the morning. So you're going to go to sleep. 24 hours prior to this, only 24 ounces of water. No nutritional supplements, okay? You get up in the middle of the night, you have to pee. You're going to have one of these cups sitting, in fact, you're going to have them both sitting on the back cap of the toilet, all right? You get up in the middle of the night, you're going to take the lid off, you're going to pee directly into the cup, all right? Don't overfill it if you have to really go, but just get a good sample in there. Now, if you go at night, that is not the only sample you're going to be gathering from, okay? We're also going to do it again in the morning when you wake up. You're going to pee again, we're going to pee into the second cup, which is there on the back of the toilet, pee in there. You are going to combine those two into one cup. So you're going to take one, you're going to pour it into the other and combine those two, okay? Now, if you don't pee at night, that's fine. Just first thing in the morning, you're going to get up, you're going to pee into just one cup, and that's what you will take your sample from, is that one cup. What we don't want to do is get the sample from just the middle of the night urine, okay? So that's important to remember. If you pee in the middle of the night, collect it, but then when you pee again in the morning, we're going to combine those two. If it's just in the morning, that's what we'll take it from. Do not try to pee into this vial. Not only is it going to make a mess, but it's virtually impossible. So don't do that. We're going to take the pipette you see here, and we're going to use the pipette to then transfer the pee from this cup into the vial. You take the cap off. You will transfer the pee into there. Okay? Now there has been a black mark in Sharpie put on the vial at the 12 milliliter mark right here. You can see that. If it's not there, you can still see the 12 milliliters. It's just hard to read. The lab didn't do a great job of marking it, so we as an office mark it for you. It's possible we forgot. So if so, just know you can read it. If you get it under light, you can see that it says 12 milliliters right there. That's where we marked it. So do not overfill it. Use your pipette, transfer the urine in there until it's all the way up to 12, and then you're done. Don't overfill it, right up to 12. Take that cap and make sure that it's put on nice and tight, all right? If it's kind of cockeyed or not on there tight, when it's being shipped, it's just gonna leak out. You're gonna have to do the test all over again and wait an extra couple weeks to get your results. Let's not do that. So cap on tight. Got it. And when you're done getting that collected, you're gonna take a Sharpie and you're gonna write 4 bits of information, 4 things. You're going to write your name, full name, first and last, on the vial. You're going to write your date of birth on the vial. You're going to write down your gender on the vial, and then the date that you collected it, right? Month, date, year on the vial. That's important because you already filled out the requisition form we talked about earlier. That information is on this form, and it's also going to be on this. So when it gets shipped in the box to the lab, they have both of these bits of information. They can put these two together. If you don't do that, things can get screwed up, all right? So let's not screw that up. So once you've got that information on the vial, you're going to put it immediately into the freezer, okay? And I'm going to backtrack for just a moment because earlier I talked about peeing into the cup in the middle of the night. You actually don't want to leave that on the back of the toilet. So if you pee in the middle of the night, cap it and put it in your refrigerator. Don't freeze it, just in your refrigerator to keep it cold so it doesn't sit at room temperature for several hours before you end up putting it in the freezer. So if you do pee in the middle of the night, walk over to your fridge, put it in your fridge. You might want to forewarn anybody else in the house that there might be some urine in your fridge. It'd be embarrassing. So anyway, make sure that's important. But now that we've pipetted into the vial, all the information on it, cap on tight, we're going to put this in the freezer. We're going to freeze it, all right? Now, from the time that you get this vial filled up, you have 24 hours to get it shipped. That doesn't mean it has to be in the lab in 24 hours. It just means you have 24 hours to have this at the actual FedEx delivery place, wherever you take it, okay? 24 hours. So you're gonna freeze it. It's gonna take a couple hours for that to freeze, and that's fine. It needs to be nice and frozen because you're gonna take your ice pack out. It's been freezing, of course, for who knows how many days, doesn't matter. This comes out of the freezer, and this is going to go into the box, back into the bag, back into your bag, frozen. If you need the wipe, that's what that wipe is for, by the way. Then you mess with the vials or the pipette cups, you can use that. The biohazard bag goes back into the box, just like that. The requisition form, which you filled out, goes back into the sleeve on top. Okay? So now that box is ready. Your sample's frozen. Your ice pack is in there too. It's going to keep it nice and cold in this box. And this box is then going to go into this bag. Drop it right in. Boom. Self-adhesed peel. Take it, peel it off, close it up, boom, good to go. Okay? The last thing we're going to do, you're going to take this return address label. It's going to ship it over to Genova in Atlanta. Okay? Genova needs you to write your name in the upper right-hand corner right here. You're going to write down your name, your return address in case it needs to be shipped back to your house for whatever reason it gets screwed up and needs to come back. And you're going to write the date on that little box right there on the right hand side. Okay? And you're going to peel off this label. There's a little return address label right here. It kind of divides in half. This label comes off. Peel it off. You can see it right there. Peels off. You're going to keep that for your records. Put that on your instruction booklet. All right? You're going to put that, peel that off and put it, boom, right on there. You're going to keep that for your records, just in case there's any issue. All right? The bigger label underneath it, this peels off. You can see right there. That's going to peel off, and that entire big label is going to go right in the middle. It's got a bullseye square right here. You're going to put that right on there, and you are done. The only thing you have to do is take it to the nearest FedEx shipment center. Here in Wilmington, the most obvious one is FedEx Kinko's, which is at the corner of College and Oleander. But there are obviously others wherever you might live. So look it up online, or if you need to call them, there's actually instructions on this blue form here. Where is it? You can look up, you can call actually FedEx to set up a pickup if you need to. They can come to your house or to your business and pick that up as well, so that's not a problem. It is important that you do not ship this on a Saturday because they don't work on Sundays. At least Genova doesn't. And since this needs to be shipped over to them as quickly as possible, you need to ship it between Monday through Friday. So that way if it does go on Friday, you can be there on Saturday and somebody will be there to get this and do the proper protocols with your sample. All right, so only ship Monday through Friday. But it does say on here to write in, where was that? It says something about, oh, yeah, to include your payment in this checkbox. There's a little checklist inside this instruction booklet. It's everything we just talked about, but it does say also make sure your payment is included. Don't worry about that. You've already taken care of that with us. So that is null and void. You don't have to worry about that. And then you're set. You've got your small little instruction booklet with your return address label. You keep that for your records. Everything else is going, you can throw this blue piece of paper away. You can throw away your cups and your pipette, garbage. Toss the rest of the urine that you had laying around. You toss that out. And then this goes off to Atlanta and you're done. Should take a couple of weeks for us to get back our results, a month the latest. So the sooner you get this done, the better. Okay?